Yes, Sarah, she is playing with herself.
Yes.
Yeah, she's fine.
Okay. And I would like to know her this dimensions, height, weight, head circumference, mentality, speech, any distress or not, and any attachment she any special features she has.
Okay,
No.
you can see her. This is Sarah, and this is her brother of same age. You can see the picture?
No. Here on the Zoom.
Yeah, okay, just wait. I will give you extra time for this, don't worry. Wait.
Pause the time, please.
Okay, now you can see.
It is coming. It is on the way. Yes. Now I can.
Okay. Okay, this is Sarah and this is her brother. Both are same age.
Okay. Oh yes. Okay. Okay. Now so I can see the height, weight, head circumference is normal.
Yeah, OFC is normal.
Okay. I would like to check her height, sitting height, and standing height. So is it possible?
Yeah, she's below third centile.
Okay. And sitting height and ratio. What is the ratio of sitting and standing?
Not required.
Okay. I would like ask to her to. I will examine her from front, back, and side. So any deformity, any special features, or any in the legs, hands, face, eyes.
Okay, what exactly you want to see?
I want to see the skin and then any deformities
This
in the
is her.
bones.
This is her. This is naked Sarah.
Okay.
You want to see more?
Okay.
You said hands. So
Mhm.
these are her hands.
Okay, 1 second.
The big hand is yours as an examiner, and the small hand is Sarah hand.
Okay, she is pale.
Okay.
She is pale or not? Okay.
This is up to you. I cannot tell you. This is her hand, and this is
Okay, I would
her
like to,
this is her fingers.
window test. I can see a window, right? Okay, so I would like to examine her back. So is there any scoliosis?
No.
Or from the side, I will see hyposcoliosis. Okay, no skin rashes.
No rashes.
Okay, I can see tummy and okay, I would see the hands. There was thumb abnormality. Can you show the picture that again? Is why there any thumb abnormality? I can see the widening of wrist is there.
This one.
Yes, no, then no, the previous one. Hand, yeah. Is there
This
any
one.
extra digit or something very?
No. There is no extra digit. No thumb abnormality.
Okay, show me the hand only. This palm.
Okay.
Is there any single palmar crease not visible? Actually, is there any single palmar crease there?
No, there is no single palmar crease.
Okay, I have to zoom it because it is not visible clearly to me. What he's showing to me in hand. I cannot see anything from this distance in the hands.
Okay, the hand
there
is
anything?
there is only paler, nothing else. Okay, move
Okay.
quickly.
Okay, I would like to see that there is no clubbing with see any recurrent degeneration marks in the hand.
Mm-hmm.
I
No,
will see
no.
her. Okay, I will like to check her blood pressure and then we'll move on. Is it blood pressure, pulse?
Blood pressure, no need. Pulse is normal.
Okay, I would see her face. So I will ask her to bring down the eyelids. So is there any jaundice, pallor I can see?
This is her face, no jaundice, but she's pale.
Okay, okay. I would like to see mouth and nose, any polyps
Poor,
and mouth.
poor dental hygiene, no polyps.
High arch palate.
No.
Okay, any ears, any hearing aid or any VP shunt on that side?
No.
Okay, I would like to examine her neck. Is there any deformity in the neck?
Where is Dr.
Is it-
Rukaiya? What about the time?
Okay, I would like to see
1
her
minute
chest.
and 15 seconds.
Okay.
Okay, I would like to see her chest and abdomen. So is there any deformity, a scar mark, pigmentation, distension I can see in the picture you show me again?
This is abdomen. No
Okay, so
scar.
is it bleeding of ribs is there?
Sorry.
Cost,
Yes, you can see. Yeah, you can see it is there. Yeah.
Okay, then Harrison sulcus. Harrison sulcus is there.
You
I
you will
cannot.
you will comment. I think it's a very visible picture. But anyhow, because you cannot ask everything examiner. This is a real exam.
Okay, okay. I can see the deformity in the legs. Is it bowing of the legs or is full picture? And then any deformity in the legs, like
No,
bowing of
no,
the knee,
no,
down
no,
knee,
no deformity. No,
any double malleoli.
no.
And forehead is broad. You
Mm,
mean prominent?
this is forehead. Yeah, it looks like okay.
Okay, I would like to examine the abdomen. So liver and spleen palpable.
No,
Kidney, spleen.
no,
Okay. No pigmentation marks, right? Capillary spots.
no,
And short neck is not there, right? And carrying angle is not there.
Time is up.
no, no carrying
Okay, thank
angles.
you.
6 minutes.
Okay, thank you.
Okay, so do I
Tell me your positive findings.
Yes, so I can see that there is a dental caries present. Pallor is there.
Mhm.
On hand examination, there is a this one uh, broadening of the wrist is there. On the chest, there is a corner bleeding is there. Harrison sulcus were present. Abdominal distension was there. Liver spleen not palpable. Then in the
Mhm.
lower limb, I could see some deformity, but not visible clearly.
Mhm.
Yes, and she is short for her age,
Okay.
and she is on less than third.
Based upon your finding, what is your most likely diagnosis?
So my most likely diagnosis is case of rickets.
Okay.
First,
Which
rickets.
type? Which type?
I could not see the alopecia in the head from the picture. So this might be nutritional rickets, or it can be vitamin type 1 vitamin D dependent rickets,
Okay. Tell me two differentials for this case.
or she has pallor. Sorry, yeah, this case. Okay, so I will go for the, it may be renal rickets also.
Hmm.
She is pallor,
Other than
but there was
rickets.
no.
Other than rickets, tell me two differentials.
It can be chronic renal failure,
Okay.
or it can be celiac disease.
Okay. What are the features you put CRF on the top? What are the feature which suggest that this is CRF?
Abdominal distension was there, so it might be ascites, and pallor was
Okay.
there. She
Okay.
was short for her.
If it was
And
ascites, so why you did not ask about shifting dullness?
okay,
You asked about kidney, it was not palpable.
so if it is CRF, then may not be palpable.
Okay. Okay. If it is celiac, so what are the points which is favoring celiac?
Celiac abdominal distension,
Uh-uh.
pallor,
Mm,
and bony deformities, rickets, rickety features,
mm.
uh, stimulatia, I mean, and short
Okay.
height
Okay.
and abdominal distension.
How you are going to investigate this
Mm.
patient?
I would like to do complete blood count to check the hemoglobin levels and
Mhm.
WBC counts, laboratory markers.
Okay.
Then I would like to go for thyroid examination, T3, T4, TSH.
Mhm.
Celiac screening, I will in the form of IgA, TTG, and total IgA.
Mhm.
Then I would like to go for the abdominal ultrasound and bone profile. I will do before that
Mhm.
profile,
Okay.
in which I will do calcium
Okay. What are the histology findings of celiac?
test.
What are the
Mhm.
histology findings of celiac?
And I would like that I would like mm, select there are four. We take sample from this small this second, and then four findings are subtotal villus atrophy can be there, crypt hyperplasia,
Mhm.
and lemon plasma cells in the lemon area, and
Mhm.
lymphocytic infiltration in the epithelium.
Okay. How you are going to manage celiac?
Celiac, I would do the for diet, so it should be gluten-free diet for lifelong, in which I will ask her to avoid the wheat, barley, rye, and oats. and I will tell the parents that there may be some risk if she is not compliant for the diet, then malignancy is the risk, and that they should be aware about that. Whenever they go out in the restaurants or outside food, they should check the label also, and restaurant chefs should be informed that the child is having celiac, gluten-free diet, apart from regular checkup for the malignancy and height, weight, growth parameters, and family screening also very important. And then she should be receiving calcium supplement till she recovers from this condition.
Okay,
Then
I think time is up.
psych- psychology and family. Yes.
Okay, Dr. Pankaj, like I think it was a very clear-cut case, and here, this was one of the case in one of the last recent exams, and there was nothing in that child except that she was pale and she was short. Okay, so when you get these two features, so please then put celiac on the top. Okay, like
Okay.
because like, let me show you these pictures again. Like,
Mhm.
let
I was
me.
looking at buttock vesting. She was not having buttock vesting, so
Okay,
that was.
I'm showing you. Yeah,
Mhm.
you can see, Dr. Pankaj, they are very wasted buttocks. I mean, they will not tell you everything crystal clear on the day of exam. Okay,
No,
like
I was looking at this buttock here
yeah,
in the picture, but
you
this
you you can see it. I mean, it's such a big pot belly, and it's a wasted buttock. She's short, she's pale. There are signs of fat soluble vitamin deficiency, that is vitamin D, you can see at least. So I think you can put celiac on the top. If you say CRF and if you say that ascites, so the next question which I asked, that will be coming to you. Why you didn't check abdomen for ascites? So that's why you need to put common things on the top. Okay, and
can we
celiac.
put rickets first? Rickets, because dental abnormality, abdominal distension in rickets, that pallor is there,
Yeah,
and though pallor
rickets.
will not be so much in the
Yeah,
rickets,
because
right?
then why there should be such a pathognomonic pallor? Why it should be such a pathognomonic pallor?
Yes, right.
Okay, so
Important.
you have to correlate things.
Yes.
Okay, so you have to correlate things, and Dr. Pankaj, when it comes to the clinical station, 90% of your job is okay. Your discussion portion is okay, and your initial portion is okay. How you approach to a patient. It's only this one portion which you need to do a bit. I mean, you need to work on it a little bit. It's not like this that you don't know it. It is there, but it's only the distribution that you want to put it number two, and I want that number one. So that thing, and that is very easily correctable. Yes, Dr. Sandeep is here. Yeah, Dr. Sandeep, you want to say something? Luckily, we have another examiner.
Dr. Tahir, I didn't hear the case, but I just looked at the pictures. So you rightly said that the common things common first. That's the most
Yes.
important thing.
Yeah.
And it should sound logical. Like here, like you can give a Sanjit Sakata syndrome or like
Mm,
severe immunodeficiency, common variable, severe common immunodeficiency, looking at
mm,
the pictures. But looking at the pot belly, first diagnosis that comes in mind is like in the Asian countries, it's severe malnutrition. On in like UK, it's a celiac disease. Yeah.
yeah. Yeah. Exactly. So as you said, common should be common and first, and rare should be rare and last. So I think the common, it's celiac, it's very common. Even in Asia now, it is very common. Yesterday, this was my case. I diagnosed in my clinic yesterday one case, the celiac. So
Okay.
that's why I'm not having her picture,
Uh,
but
But there was wrinkling of the skin at the like thighs or uh, like just like abdomen. Did you find that one in that patient?
I'm sorry, Dr. Pankaj, I muted you, but see, I mean, celiac, it is a condition of a
Oh, sorry.
malabsorption. It's a malabsorption condition, and in malabsorption, it is common that you see patients like this. Okay,
Yes,
so
no, what I'm asking in your case, did you find the wrinkling of the skin over thighs, buttocks?
well, that was all the classical features will not be there, but how I picked that, she was very short, okay,
Hmm.
and the second thing, she was very pale, and there was a history of chronic diarrhea since 7 months of age, and there was very wasted buttocks, signs of vitamin D deficiency was very visible. Vitamin D deficiency I could not pick. History also was not suggestive of, and but vitamin D deficiency rickets was there was broad wrists, and there was this ricketic rosary present. So these things were very much clear,
Mhm.
and early clubbing was also
Okay.
there.
Okay, but in this picture you showed that was no clubbing, right? Window was seen.
Yeah, window was seen, but anyhow, it's not necessarily that in early celiac you see this thing. But anyhow, there was clubbing. Sometime, I mean, they will hide few things from you. They will not give you classic thing to make it to make your life easy. Okay.
Yes.
Okay.
Also,
Yes,
like
yes,
this
please.
chronic, yeah, sorry. Like also these chronic disorders will have a spectrum of presentation. So you
Yeah.
don't expect
Yeah.
all the classical signs to be present in one case. So
Mm.
if it is early cases, then you might not find clubbing or you might not find the short stature. So you have to think logically in that particular scenario. So don't expect the clinical findings in one
100% correct. Yes.
diagnosis. Differential. Yeah, don't have to hit the bullseye every time.
Yes.
Yeah. Okay.
Okay.
We will be if I get any interesting case. So